So we'll talk about the ribs. So we have 12 pairs of ribs in our body. Okay. So let's know what is ribs. It is a flat, ribbon-like, elastic, bony arches which is extending from the thoracic vertebra posteriorly and to the lateral border of the sternum anteriorly. So the ribs are the bony arches which is attached anteriorly with the sternum and posteriorly with the thoracic vertebra. Okay. And the anterior end is connected to the costal cartilage, and actually this costal cartilage is attached to the sternum. Now what are the numbers of the ribs? We have 12 pairs of ribs. That means 12 ribs on each side of the sternum. Now some arrangement and general outline. The gaps between two adjacent ribs is known as intercostal spaces. So between two ribs, the space is known as the intercostal space. And some important things, that the length of the rings increases from the first to seventh rib and then gradually decreases. So the seventh rib is the longest rib, and the transverse diameter of the thorax increases progressively from the first to eighth rib, and hence the eighth rib has the greatest lateral projection. So let's see it. If we see it from the bony thorax, so it will be more clear. Okay, so you can see, look at that, the transverse diameter is increasing from above downwards. So from the first rib, second, third, fourth, fifth, sixth and seventh, you can see the greatest transverse diameter is at this level, isn't it? So when you go downwards, the transverse diameter will be more increased, and the greatest transverse diameter is at the level of cervical 7 vertebra. Sorry, the cervical 8 vertebra. Then the anterior end of the first 7 ribs are connected to sternum with their costal cartilages, and the cartilages at the anterior end of the 8th, 9th and 10th ribs are joined together to the next higher cartilages. That means the first 7 ribs, that means from 1 to 7, these first 7 ribs are attached with their costal cartilage to the sternum, but the rest one, that means 8, 9, 10 ribs are joined together to their higher costal cartilages. But the 11th and 12th ribs, their anterior ends are free. That means they are not attached to the sternum, therefore they are called floating ribs. So let's see. Okay, so if you see from this picture, okay, so we are talking about the first 7 ribs. Look at that, 1, 2, 3, 4, 5, 6, 7. These 7 ribs are attached to the sternum with the help of costal cartilage, but the rest 3 ribs, that means 8, 9 and the 10th, these 3 ribs are attached to the sternum with the help of the costal cartilage of the above costal cartilage. That means the 8, 9 and 10th ribs is attached to the costal cartilages. They fuse, their costal cartilages fuses and they attach to the sternum with the help of the upper costal cartilages. And look at that, the last 2 ribs, that means 11 and 12, their anterior ends are free. That means anterior ends are not attached to the sternum, so that's why they are called floating ribs. Okay. Now come to the classification. The classification of the ribs are very important. According to the features, they are classified into typical ribs and atypical ribs. The typical ribs are the from 3rd to 9th rib, and atypical ribs are the 1st, 2nd, 10th, 11th and 12th ribs. The typical ribs have same general features. They have general features in common, so they are called typical ribs. But the atypical ribs have special features, special characteristics, so they can be differentiated from the remaining typical ribs. And number 2, according to the relation to the sternum, we already seen in the picture, last picture, the first 7 ribs, they are attached to the sternum, their anterior end are attached to the sternum, so they are true ribs. But from 8, 9, 10 and 11, 12, last 5 ribs, they are not directly attached to the sternum. That means 11 and 12 are floating, and 8, 9, 10 they attached with the sternum with the help of the costal cartilage of the above costal cartilage. Okay, so those who are directly attached with the sternum, these are the true, and those are doesn't are known as false ribs. Okay. Now number C, according to the articulation, we can divide the ribs into 3 parts or 3 classification. That is the vertebro-sternal ribs, vertebrochondral ribs and floating ribs. Vertebro-sternal ribs, that means vertebro-sternal, that means these ribs are attached to the anteriorly with the sternum and posteriorly with the vertebra. So these are the first 7 ribs. Then vertebrochondral ribs, that means 8, 9, 10, these ribs are attached posteriorly with the vertebra and anteriorly with the costal cartilage, not with the sternum. And last 2, 11 and 12 ribs are known as the floating vertebra. Okay, floating ribs or vertebral ribs. That means they are only attached to the vertebra and anterior ends are not attached. Anterior ends are free. So these are the classifications of the ribs. Now we will start with the typical ribs. The typical ribs have general features in common. So each rib has 3 parts. Okay, anterior end, the posterior end and the shaft. Okay, so the typical rib has 3 parts: anterior end, posterior end and the shaft. Look at that, the anterior end bears a concave depression. The anterior end has a concave depressions. The posterior end consists of a head, neck and tubercle. This is the head, then this is the neck and then a tubercle. So the posterior end possesses head, neck and tubercle. And the shaft is the longest part and it is situated between the anterior end and posterior end. And look at that, the ribs are always in curved manner. Okay, and there is a costal groove on its inner surface near the lower border. So the shaft, it has upper border and lower border. So near the lower border, in the inner surface of the typical ribs, it has a groove that is known as costal groove, the darker color. This is a costal groove. So the costal groove is situated in the lower border of the inner surface of the shaft of the typical ribs. Okay, and this area is called the angle of the rib. Okay, and it is situated 5 centimeter away from the tubercle. So what is angle of the rib? The 5 centimeter away from the tubercle, the ribs abruptly change its direction. This is called angle of the rib. Okay, so this is angle of the rib and it is situated 5 centimeter away from the tubercle. Now come to the features and attachment. In the anterior end, it bears a small cup-shaped depression which joins with the corresponding costal cartilage to form a primary cartilaginous costochondral joint. Okay, so look at that, there is a cup-shaped facet or depression and it is attached with the corresponding costal cartilage and form the costochondral joint. Now the posterior end, we already shown you the posterior end has a head, a neck and a tubercle. Now come to the head. The head possesses two articular facets. One is upper smaller facet and lower larger facet. The upper smaller facet, it articulates with the next higher vertebra, but the lower larger facet, it articulates with the body of the corresponding vertebra. Look at that. This is the head and it has two facets, upper facet and lower facet. The upper facet articulates with the corresponding higher vertebra, but the lower facet articulates with the corresponding vertebra. Now come to the neck. The neck lies in front of the transverse process of the corresponding vertebra and it has two border and two surface, superior border, inferior border and anterior surface, posterior surface. The upper border is sharp, crest-like, but the lower border is the opposite, it is rounded. And in the posterior surface, there are some foramina. Okay, so the neck, this is the neck. So this part is the neck. So it has sharp crest-like border, upper border, lower border and two surface, anterior surface and posterior surface. And in the posterior surface there are multiple foramina. Now come to the tubercle. It is situated in the outer surface of the rib at the junction between neck and shaft, and it is divided into two parts, medial articular part and lateral non-articular part. The articular part bears a small oval facet. The articular part bears a small oval facet which articulates with the transverse process of the corresponding vertebra. But the non-articular part is rough and provides attachment to some ligaments. So this is the tubercle. Okay. The tubercle has two parts, articular part and non-articular part. This articular part, it articulates with the transverse process of the corresponding vertebra, and the non-articular part, there is no articulation here, some ligament is attached. Now come to the shaft. The shaft is thin and flattened and it is also curved. The shaft has also two surfaces, outer surface, inner surface, and two border, upper border and lower border, and two angles, posterior angle and anterior angle. Now come to the upper border or superior border. In the superior border, it presents outer lips and inner lips, two lips. So this is the upper border, this is the lower border, and it has two surfaces, outer surface, this is the outer surface and this is the inner surface. Okay. Now in the upper border or superior border, it has two lips. We already said the outer lip gives attachment to the external intercostal muscle and the inner lip gives attachment to the internal intercostal muscles. So outer for external, inner for internal. So it's very easy to remember. Now the lower border gives origin to the external intercostal muscle. So the outer lip of the upper border and the lower border gives origin to the external intercostal muscles. Now come to the surface, the outer surface and inner surface. The outer surface, it possesses two angles, posterior angle and anterior angle. And inner surface, we already shown you in the picture, there is a costal groove near is the lower border. And the most important thing that is asked in the Viva, what are the structures that lodges in the costal groove? So these are the vein. Okay. Intercostal vein, intercostal artery and intercostal nerve from above downwards. Vein, artery, nerve. or you can remember like vein. An internal intercostal muscle is attached to the floor of the groove. Okay, so let's see. So we are talking about the shaft. So look at that, in the inner surface there is a costal groove. Okay, so this is the costal groove, and what are the structures that lodges in the costal groove? From above to downwards: vein, intercostal vein, artery and nerve. So intercostal vein, artery and nerve. Now there are some three important characteristics of a typical rib. Number one, it is curved along its entire extent, it is angulated, it has some angle, and it is twisted. So you can remember like this: it is curved, it is angle, and it is twisted. See a cat. Okay, so the typical ribs are from third ribs to ninth ribs. They are known as typical ribs. Now come to the atypical ribs. The atypical ribs, at first come to the first rib.